You are listening to I Am Refocused Radio with your host, Shamaya Reed. This show is designed to inspire you to live your purpose and regain your focus. And now, here's your host, Shamaya Reed.
Hey, welcome to I Am Refocused Radio. Once again, we are here today with another show. We have a special guest today. She was here before, not too long ago. We have her back on, Dr. Ingrid Skop. She's the Vice President and Director of Medical Affairs for Charlotte Lozier Institute. You can go to the website, lozierinstitute.org. Today, we have a hot topic. We have some things we're going to kind of unravel here, but today's topic is the untold dangers of abortion pills and misunderstood pro-life laws. We're going to have her kind of set up the conversation. It starts with a claim that was made by Vice President Kamala Harris and other abortion advocates, and has something to do with two stories of two women who unfortunately had some medical complications that led to their deaths of Amber Thurman and Candy Miller. First and foremost, thank you for your time. I know you're busy, so appreciate you coming to the studio today.
Thanks. It's great to be back with you.
So for our audience, kind of set up the whole story. What happened? What were the claims that were made? And what's the overall context of those two stories?
Right. So about 2 weeks ago, ProPublica published an article where they highlighted two women who had died in Georgia. And the article pointed the finger at Georgia's heartbeat law that protects a baby after the time that his heartbeat can be detected. And afterwards, as you mentioned, Vice President Kamala Harris went to Georgia and held a press conference where she also blamed the law. Now, I think what we've seen is the Democrats somehow think that abortion is a winning issue for them, but the way that they frame the narrative is so deceitful and dishonest that I think they must be somewhat insecure that if they had a discussion on the merits, that the American people would be much more likely to oppose their wide open abortion without restrictions policy that they are advocating for. Regarding these women, it was a tragic story. Amber Thurman is a woman who sought an abortion. She drove to North Carolina and she was given abortion pills, mifepristone and misoprostol. And I want to just let you know that these drugs have been promoted to women for decades. They're told they're safe and effective. They're safer than Tylenol. This has nothing to do with the overturn of Roe v. Wade because women have been given these pills for a long time prior to that. In fact, the FDA has removed critical safeguards that allows these drugs to be ordered without any in-person evaluation. So no pre-abortion testing,
no law.
Exactly. Yeah. No counseling, no blood work. So these changes all happened before the overturn of Roe. This was the plan all along, these medically unsupervised abortions. Well, sadly for Amber, she had a complication that is common with these drugs. About 1 out of 20 women will fail to express all of the pregnancy tissue. And in her case, it became infected. The FDA warns about this. They have a black box warning on mifepristone, alerting doctors that women can get very sick very quickly. Well, anybody who's progressed beyond the third year of medical school knows that when that infected tissue is hampering a woman's treatment, it needs to be removed. But for some reason, Amber did not immediately go to the doctors. She may have been falsely worried that she would be prosecuted. No state law will prosecute a woman who is, we consider, another victim of abortion. And yet she did not go until she was very sick. And then for some reason, the doctors delayed another 20 hours before they took her to surgery, and sadly, she died on the operating table. Amber died of a complication of mifepristone and misoprostol, the abortion drugs that women are being told are safer than Tylenol. She did not die, nor was this death in any way related to Georgia's abortion laws. Georgia allows a doctor to do whatever they need to do to save the life of a woman. And in fact, it specifically says removing a dead unborn baby, which is what needed to happen in this case, is is not an abortion, nor is treating a ectopic pregnancy or miscarriage. So the laws are very clear. What happened with these doctors, I don't know. It may have just been medical malpractice. And I'll tell you another way that we can tell that this was a very politically driven narrative. There's another young woman whose name no one has heard. Her name is Aliana Dixon. She died of exactly the same complication in the same year, 2022, in Nevada. No one has heard about her death because her death is not politically expedient. Nevada has no pro-life laws that could be blamed for her death. But I think we just need to go back and recognize women do suffer complications from these drugs. They're not as safe as we're told. The second woman who died in Georgia, a little more complicated situation, Candy Miller. She did order these drugs on the internet like the FDA allows. They were delivered in the mail from the Netherlands. So she had, again, a totally unsupervised medication abortion. She also had a failed abortion. Her body did not get rid of the tissue. It's a very painful process. About half of women who have these types of abortions describe the pain as severe because their body is going into labor. It appears that Candy died with a toxic mix of fentanyl, Tylenol, and Benadryl in her system. So this poor woman was having such a painful, excruciating experience that she somehow sought out fentanyl and died from that. Again, she may not have sought medical care because she falsely believed that she would be prosecuted, but no pro-life law wants these women to suffer. We want to protect their unborn children, but if they do suffer a complication from an abortion, from a miscarriage, from pregnancy, these laws allow them to be treated and they will not be prosecuted.
Once again, listen on Refocus Radio, and we're talking to our special guest for today, Ms. Dr. Ingrid Skop, and in the title that we're focusing on, the misunderstood pro-life laws, kind of educate our audience. What are some of the things that we might see on social media or the news that talks about these laws, and what are some maybe ways we have a little bit more clarity on what actually is happening?
Yeah, so the misinformation, the fear-mongering campaign has been widespread. We saw immediately after the overturn of Roe v. Wade, all of us have seen these articles, right, where they have said doctors don't know how they can abide by the law. They don't know how they can provide medical care. We hear the narrative that doctors are going to leave pro-life states because they can't provide, quote, necessary health care. And really, people should understand 90% of obstetricians do not perform elective abortion. And yet we all have been willing to intervene when we needed to end a pregnancy to save a woman's life. We did it before the Dobbs decision, and we continue to do it after the Dobbs decision. The only thing that these pro-life laws are doing is saying you cannot electively kill a baby that is living in his mother's womb. But if there is an emergency, they do allow intervention. But sadly, we've all seen the articles that say that women are turned away from ERs, that they haven't had their ectopic pregnancies treated. I don't know why that would be happening because the laws are quite clear to anyone who wants to read them. But I believe that apparently some people read the pro-abortion media, but they don't read the actual laws. And so I think as a society, we need to have an honest conversation. We need to not couch it in lies and fear-mongering and euphemistic words like women's reproductive freedom. We need to talk about the fact that science tells us the child in his mother's womb is a separate individual. He's not a part of, he's within her body, but he's not like an arm or a leg or an appendix. He is an independent, genetically distinct individual. Abortion has the intent of ending his life, and more than 95% of abortions in our country are in a healthy mom and a healthy baby, and are performed for largely social and financial reasons. So the honest discussion would involve, do we end human life for these reasons, or are there other options that we can offer women in crisis to give them support, to bring the fathers in, to create families? Because so many women seek abortion because the father does not want to be involved and they're alone and abandoned. So for almost 50 years, we've been offering women a suboptimal option. We haven't done the hard work of solving their real problems. making it so that they can go to school, making it so that they can work, that they can have childcare, that they can have access to the things that they need in order to raise their children. Instead, we've just said, here's your option. You can end the life of your child. And women may choose this option in crisis, but so many of them regret it. So many of them wish that they'd had another choice. And so we have a great opportunity in the wake of the overturn of Roe v. Wade to have these discussions, to look at the different states and the different states' laws to find out ultimately, where do women do better?
And going back to Amber Thurman's case, it appears that her condition, it was mismanaged at the hospital, unfortunately. And knowing the details that we do know about her case, could this be due to some misconceptions that are looked at with the procedures under pro-life laws?
Well, I don't know what was going through the doctors' minds, but we have seen some doctors that have been irrationally fearful of laws and confused beyond what they should be if they just merely read the law. So if that is the case, that this was in any way related to the doctor's hesitancy to intervene, again, the babies, her twins were already dead. All that was needed is to remove the infected tissue that was threatening her life. So I hate to think that there's any physician in our country that would refuse to intervene in such an obvious situation. But if there's even an inkling that that's the case, that doctors are performing poor quality care because of confusion about the laws, we must explain the laws to the doctors. One thing that states are doing this, Texas is doing this, our Supreme Court, our Texas Medical Board, many states are explaining the laws to doctors. But if there's any confusion, we need to do more. We need to make sure doctors understand what is and is not permitted with these laws for the sake of the women. We can't allow women to continue to be harmed and to die unnecessarily by doctors' misunderstanding of the laws.
This topic will never go away, in my opinion. I think this is an ongoing discussion. But one thing that seems to never fail is the emotion behind either side you choose. All right. If you listen to this, on this platform, we try to be fair. We try to say women can make their choice, but at the same time, we think it's necessary to have fairness on both aisles and give them the education that they need based on professionals like our guest today. When you look at the opportunity, this is something that a lot of people are focusing on during the election. Women, we have our rights to choose. Well, if you were to ask a question to kind of question their question, could you possibly ask, then why not look at all your options?
Yeah, I agree. What we've seen is that many pro-abortion organizations are actively trying to destroy other options for women. We've seen an aggressive campaign against pregnancy centers that usually offer all of their services for free, counseling, material support, ultrasounds, in order to help women recognize that there are other options if you want to give birth to their child, to show them the science of their child on an ultrasound, because so many women are told it's a clump of cells, and then they discover belatedly, no, that child was very human in appearance from a very early gestational age. So yes, that's my cry and my plea, is that we begin to have an honest conversation. I welcome a discussion with someone who doesn't agree with me, but we need to define our terms, not be misleading, not fill it full of euphemisms, but talk about what's really happening in the science. That's why I love the Charlotte Lozier Institute, because we do look at the science. We look at the peer-reviewed literature. We make very complex, coherent arguments based on what the science says. So anybody who's interested, even if especially if they don't agree with me, I'd invite them to come to our website and read, and then we can begin to have a conversation where we can truly do what's best for women.
Let's dive deeper into this fear thing, because, and I say that consciously because I'm not trying to offend anybody, but I feel like you gotta identify the pain points and explore further. So my next question is, for those who are making claims that women fear prosecution or denial of care under pro-life laws, how do pro-life laws actually address medical care when a mother's life is in danger?
So every pro-life law, there are 24 in effect right now, has a wording to the effect of a doctor may use his reasonable medical judgment. Some say good faith medical judgment. That's wording from long before the Dobbs decision, which basically means a doctor may use his clinical skills and abiding by the standard of care. What would another physician in this situation do? And he may use those skills to determine if an abortion is needed to save the life of the mother or to prevent substantial impairment of a major bodily function. So we think about maybe cardiac failure, kidney failure, some sort of severe illness. And the Texas Supreme Court happily expanded upon this and reminded doctors that certainty does not have to occur. Anybody who's in the field of medicine knows that we don't know with certainty whether a complication will kill a woman. But as obstetricians, we know what complications can kill a woman. And so we do know, and we should be empowered to know that we can intervene. The Supreme Court also said that immediacy is not required. We've seen in some of these articles confused doctors saying something like, well, I couldn't intervene until she was dying. Of course you can intervene when you've made the diagnosis of a complication that could kill her. If you wait till she's dying, you may be too late. That's what we saw in Amber's case. She was dying in the emergency room. They tried to intervene and she still died. So these are critical things for doctors to understand. We just need to keep having this conversation and we just need to keep clarifying these laws. And in my opinion, the states could do more. They could, there are some states like South Dakota that have what they call it a medical education bill, where they're creating videos that they then are asking all of their doctors to look at, where they explain very in depth how the law allows them to intervene. Here in Texas, we do keep track of how many abortions have been performed for the life of the mother. And since 2022, there have been 113. So it doesn't happen that often, but doctors in Texas have figured it out. They have performed abortions when they've needed to, and they've reported it to the state. And no doctor in Texas or anywhere in the United States has been prosecuted for performing an abortion to protect the life of the mother. So this fear is irrational. These states aren't going after doctors. No one wants to second guess a doctor. We want doctors to be empowered to use their own clinical judgment to provide the best care that they can for a woman. And so this fear mongering by pro-abortion media is damaging. It's damaging doctors' ability to practice, and in some cases, it may be harming women. So obviously, we need to get more information out, not less, so that doctors understand when they can intervene.
When it comes to poor abortion advocates, they often claim that abortion pills are safer than Tylenol. When you look at points being made in that case, what would you say to that point as far as medical concern?
Well, we need to understand that in the United States, there is almost no data about abortion that is mandatorily collected. On a federal level, we don't know the numbers, we don't know the complications, and we don't know the deaths that occur after abortion. This narrative that it's safer than Tylenol is actually looking at the undoubtedly undercounted deaths from abortion that the CDC knows about. And it's comparing it to the Americans who die of Tylenol overdoses, about 600 a year. Obviously, that's very deceptive because in Amber's case, she died using these drugs exactly the way the FDA says they can be used. So this wasn't a misuse of the drugs. This is how they tell women to use it. And yet she still died. Obviously, a Tylenol overdose is an entirely different scenario. Usually that's in the context of a suicide attempt. So you can see how misleading, deceptive that is. But these poor women, when they're told that, they think, oh, I have an easy solution to my problem. My Tylenol took care of my headache. Therefore, my pregnancy will just magically go away. They don't know they're going to go through this pain, this bleeding, passing tissue. They don't know, in many cases, they're going to see their unborn child's body. And they don't know that about 1 out of 20 women are going to end up in an emergency room requiring emergent surgery. And that on a very, very rare occasion, that they can die from a serious infection, as Amber Thurman did and as Aliana Dixon did.
Yeah, I wanted to ask a follow-up question. You as a woman yourself, you can answer this for me. How important is it for you to know your rights as a woman? Because I feel like maybe there could be common ground there. And the second part of that question is, then how could we better educate women that pro-life is not trying to punish them?
Very good question. So as a woman, as a mother, and as an obstetrician-gynecologist for over 30 years, the best thing I have ever done in my life is to bear my 3 children. I adore my family, but I recognize that there are women who don't want babies or are in a situation where it would be problematic to have a child. And the good news is we have very reliable contraceptive methods. I've spent 30 years trying to help women prevent an unintended pregnancy if they don't want to. But I've also spent 30 years seeing so many women who've been harmed by abortion, physically sometimes with mental health conditions like anxiety, depression, substance abuse, self-harm. These things do happen. Again, they don't happen to every woman, but they happen commonly, much more commonly than women are told. And the reality is, I don't believe that making a decision for an abortion is a decision that is made without thought, that is an easy decision in any woman's life. I think that it's a tragedy for any woman to reach the point where she is looking at a decision to end the life of her unborn child. But what I have seen also is that when women have maybe initially had a surprise pregnancy that they thought was going to be a problem, but if they've continued to carry that pregnancy to birth, they've loved that child. I've never seen a child born that was not loved by his mother. So the reality is that if a pro-life law does slow a woman down where she doesn't fall into the reflex of having an abortion, with time, she begins to desire that baby. So it can be a continuum. That child is not always unwanted and not unloved. And again, importantly, we need to encourage men to be responsible if they don't want to have children. Again, to be careful the women that they choose to have sex with, because pregnancy is a known. It's not a complication. It's a known thing that can occur normally with the act of sexual intercourse. So to take precautions so that a pregnancy does not result if it is unwanted, but to be aware this could result in a child. And you know what? That child is my child. So instead of couples reflexively ending the life of their children, and we know that men regret this too. Maybe not right away. Maybe there's a sense of relief where they say, well, that problem's behind me. But down the road, maybe when they have a child that they desired, they think back, what about the one I lost? You know? And so it's devastating for couples, and it remains devastating. And sometimes the harm grows worse as more time passes. So, you know, that's how we should be thinking about this. How do we work upstream to prevent unintended pregnancies from happening? And then how do we support women and bring men into the relationship if an unintended pregnancy does occur?
Once again, this is on Refocus Radio, talking to Dr. Ingrid Skop. Go to her website, lozierinstitute.org. I want to point out some facts that I brought from Amber Thurman's case and Candy Miller's case. So Amber, she died after complications from taking abortion pills. She sought out drugs from a North Carolina facility after missing a surgical abortion appointment. She developed sepsis due to incomplete expulsion of pregnancy tissue and result in infection. When you look at that, and I'll talk about Candy real quick. Candy Miller, she had multiple medical conditions, including lupus. She ordered abortion drugs online. She died after the drugs failed to clear her uterus, leading to infection. When you look at these facts of their case, one will think possibly could there be questions that they can ask about pro-choice and what they're trying to say about pro-life, because there seems to be a gap between one side saying, well, it's my body, my choice. The other side is saying, well, we're not trying to choose for you. We're trying to give you an option to choose life. And I get it. Every situation is different. It's a very complex web of circumstances and environments and people and stories. And I get that. No yes or no answers. It's not that clear cut. But there seems to be a gap between, yeah, it's my body, my choice, but we're not trying to make you choose death. Like, that makes sense?
Yeah, I think the important, like, to start the conversation, we need to recognize and acknowledge that a new human being is in existence. So that's what we're talking about. We're talking about ending the life of a human being. And so that woman, even if she doesn't want the pregnancy, she's not preventing herself from becoming a mother. She's already a mother. She's already got a child in her uterus. So recognizing that, but I think that part of the disconnect in the conversation is that pro-life people recognize that's a human being and I want to protect that human being. Pro-choice people, I believe that many of them really do have good intentions. They just have decided that the needs of the woman take priority over the needs of the child, that somehow the child is a human being that does not have the rights of a woman. So, of course, I disagree with that empirically, but I understand that that's where they're coming at it. But I think that what they need to investigate a little bit more is this what the woman needs? Is it making her life better? As I said earlier, the laziness of our society to reflex to abortion for 50 years. I mean, remember, we had almost no restrictions until 2 years ago. Women are not doing better. You know, we haven't, in many cases, child care, workplace conditions to allow a mother to work and take care of her child, those have not kept up, right? So by promoting abortion, we've not had to say, well, how do we make it so that a mom can work? Colleges, University of Texas, Texas A&M, they don't have good child care available for students. So these students are like, if I have this baby, I'm going to have to drop out of college. There's no reason someone can't continue to go to class and study for test and take care of a baby if the college was supporting them. So those type of things we haven't addressed because we've just allowed ourselves, well, this is the option, take it or leave it, right? And so, I think we need to investigate. And of course, at Lozier Institute, we've done a lot of papers on these type of things, like how does it harm women physically, mentally, but also economically? People think it's a no-brainer that women will do better financially if they end the lives of their children. That's not proven. On the short term, maybe if she, is staying home with a baby, she's may not be working her job. But again, especially if couples come together and marry and raise that child so that the mom is not a single mother living in poverty, there's no long-term impact. And yet those families have the benefit, the joy of this child that maybe they didn't anticipate. But again, as I mentioned earlier, they love by the time that child comes. And by the way, a topic for another day, but the total fertility rate in the United States is way below replacement, 1.6, when it takes 2.1 children per couple to replace ourselves. So we're closing schools, we're closing playgrounds. We don't have new young workers to enter the workforce to maintain our social programs for our older people, because we've ended so many of those lives of those young people. So, there's a lot to dig into, but we should be willing to really ask these hard questions. How has abortion helped us? It's certainly, after 50 years of widespread abortion, the United States has the worst maternal mortality in the developed world. It's not been saving our women from maternal deaths. That's very complicated. We've written about it. We can talk about it another day. But again, these assumptions, in many cases, are not true that many pro-choice people think are true.
Once again, listen on Refocus Radio, talking to our guest today, Dr. Ingrid Skop. And you go to the website, lozierinstitute.org. I do want to make it clear, heart goes out to the family and those who are friends and family loved ones of Amber Thurman and Candy Miller. Sad situation. This show, like always, is meant for education, not to force anybody to make a choice on either side. But hopefully you can take what we give you as value. So last question I have for you is, I said it before, I say it again, this topic is not going away. It's very strong feelings on both sides. If there were any common ground to have continued productive conversations, what are some of the things that the pro-life movement could offer to say, hey, at least let's have a fairness of information that is out there?
Yeah, I think one thing that both sides have in common is that they both do care for women. And so that's the conversation, and of course, continuing to have the scientific discussion about it's not a part of a woman's body. It's not woman's bodily autonomy when it involves the body of another human being. So, recognizing that. But even if people want to start with what's best for women, that is a conversation that I welcome. And again, we've published quite a bit about this. Because the data is not mandatorily collected, the abortion industry drives the narrative. They publish studies saying we think complications are few, but I'll tell you what happens. Anywhere from 15 to 50% of the women that they've sold abortions to, they do not know the outcomes. Those women have been lost to follow-up. So I think we can see it's deceptive to even say you know anything about that large proportion of women whose outcomes you don't know. And the better quality studies, again, show us far more complications than abortion industry studies. So we do need to be aware of the quality of the data. But if we really want to know the answer, we should demand better quality data. We should demand mandatory complication and death reporting, which currently our country does not demand.
Well, once again, if you want to read more about this, please visit lozierinstitute.org and follow up on everything that Dr. Ingrid Skop is up to and doing. And like always, I want to say thank you for your time.
Thank you.